I'm Ellen, and I'm so excited to bring another conversation to you today. Today, we are unpacking trauma, and we have an incredible guest list today. So, I'm going to let Sheena introduce everybody, and we're going to get started.
Hi, everybody. I'm Sheena. All right, so today we have an all-star group of doctors. I'm proud to be here with you guys today. All right, so first we have Dr. Italo Bronw. He is an assistant professor in emergency medicine at Stanford. He's also a clinical instructor of social emergency medicine at Stanford as well. And he really specializes on social medicine and health equality. He's also the chief impact officer of TARP medicine, okay? So, and then next we have Dr. Utibe Essien, sorry. He's an assistant professor of medicine at Pittsburgh and a primary care physician. And recently he was recognized as one of the top leaders under 40 who's transforming healthcare by the Business Insider. So congratulations to you, sir. And then we have, last but not least, Kevin Simon, who's a board certified psychiatrist. He's also a senior child and adolescent psychiatry fellow and an addiction medicine fellow at Harvard Medical School. So we appreciate you too as well, Dr. Simon. All right, so first, I just want to start off with Dr. Bronw, because today we're just unpacking trauma. We're trying to figure out how we can associate these type of things with trauma in our brains and compartmentalize them and figure out how we can make our community better. So Dr. Bronw, tell me, in your opinion, what is trauma to you?
Well, the first thing that I think about when breaking down what trauma is, I start to immediately think about the ways that events have affected people at a deeper level, an emotional level. And this can be anything that's physical or seen or experienced. That endured experience has a lasting effect, and it may lead to certain, I would say, downstream problems or potentially the reluctance to share certain experiences with others. I've seen it a lot in the emergency department. Unfortunately, I get it when it has gotten to a point where it's so unaddressed or hasn't been dealt with that it leads to some type of catastrophic event and possibly an acute psychiatric emergency. So that's the way I encounter it. I see it a lot in my work with barbershops where brothers come in and it takes a while, but eventually they start to unravel these experiences that have gone, severely unaddressed. And so I think that when I think about trauma, I look at the entire spectrum of it, and I see that in America, we haven't had a much needed conversation around this topic.
Dr. Bronw, explain to me your trap medicine thing, because I know I'm probably sure you're going to mention barbershops again, and we don't know what you're talking about. So tell us what this barbershop thing is.
No, certainly. So a brother of mine named Jamil Lacey, he's the founder of Trap Medicine. Known him since my days at Morehouse College, one of the first guys I met in Graves Hall. And over the years, we just talked about the ways that communities of color seem to be decimated by these feelings of depression, anxiety, unaddressed trauma that comes from just living in a society that doesn't seem to want us, and a society that consistently reminds us of how undervalued or low value we are. So in trying to unpack that with him, we realized these are the same conversations that brothers are having in barbershops across America. You walk into a barbershop right now, you're going to get a conversation about LeBron James. You're going to get a conversation about whether or not Jay-Z still has the lyrics that we love to listen to, and we'll continue to feed into that. But you're also going to hear about brothers talking about their jobs, their relationships, their kids, their own belief if they're actually going to live long enough to experience a fulfilling life. And so at that point, you have a nexus where you can reach people. And so that's what trap medicine represents, is being able to evaluate this and create a platform where brothers can exchange these ideas and get health wellness and increase their literacy. Barbershop health interventions are not new. They've been around since the 70s. People have been using safe spaces in Black communities forever to try to address health issues. We know about churches. We know about salons. We know that the Black barbershop is like the country club for brothers. So using that exact same medium, we try to approach this issue of trauma.
Okay. All right. I think that's super cool. I think if that's
I didn't know about this trap medicine. That is incredible.
right.
Incredible.
Because I think that
Thank you, guys.
there's so many men of color who don't necessarily know where to speak about these things, and then speaking about these things has somehow become almost like a negative. Like people don't want to talk about it because that's like, you know, cliche, or that somehow represents your character in the wrong way. But those same men carry out that trauma in different ways throughout their life, and then they're building families on top of that trauma, and nobody ever deals with it. Even
it never gets clear from the table.
exactly.
It never gets clear from the table completely. And to the point where brothers don't even know that that you can actually unpack this stuff. They're worried about being judged. They're worried about having conversations that make them appear weak, especially in a society where you are already from the age of like 10 or 12 considered a threat, considered somebody that is potentially not going to reach full expectation, more likely to end up in jail than to end up inside of hospitals serving patients. So it's important for us to make sure that we continue to remind brothers that this is a stigma we can address, and we do it in spaces that are culturally approved, and we do it with providers that have inherent understanding and knowledge of these communities. We're not outsiders, we're familiar. I've been growing up in a barbershop since I was a kid. I remember Mr. Bronw was my first barber, and I remember having the conversation about wearing condoms with him. I remember about having conversations with barbers about what I'm gonna do when I go to college, and hearing about don't go out in the streets and be a fool with those other guys. So it's a long history of this stuff. What's going on, Kevin?
Yeah, no, I just wanted to highlight your point about the evidence about barbershop. So, we have, two women here. Women uniformly regularly see a provider, right? So you go to your OB-GYN multiple times a year. If you get pregnant, multiple times within that pregnancy, right? For men, it's really not until about 40, 45 and older that we routinely actually see a provider. And then when we actually do, it's only about once a year. How often do men see the barber, right? There's 52 weeks in the year, some actually 52 weeks out the year, but on average, you might be able to get 20 touch points with a person. And that's a lot, right? So, a lot of people, unfortunately don't have access to a therapist, don't have access to a competent, culturally informed therapist. Yet here's the barbershop that is a melting pot for people to come feel relaxed, come talk about issues, right? So why not bring providers to the barbershop? So trap medicine, it's a beautiful model because it already exists. We don't have to recreate it. And people come naturally feeling comfortable. And so there's been a lot of studies where they actually end up getting grant funds and say, hey, if you come, you talk, you get your blood pressure checked, hey, we'll
cut you for free.
Right.
So I think that's, in my field, I'm a nurse. And in my field, I have noticed that a lot of Black men don't even tell their families what's wrong with them. And a lot of times it comes down to the nurses, and we be like, oh yeah, so your husband, he has blah, blah, blah. And they be like, he got what? And a lot of times, like, they don't necessarily explain that. They don't necessarily communicate that, especially when it comes to STDs and sexual health and all that kind of thing. A lot of men don't know what's wrong with them until it's way too far advanced and they haven't had those kind of conversations with their practitioners. I don't know if it's because of, well, listen, y'all men, y'all tell me, why, because I'm sitting here talking like it's not.
I was going to say.
So why?
So I can start. I mean, I'm one of those primary care docs that folks come through and see once a year, and the one who's discovering that lump that wasn't ever seen before, or that symptom that hadn't been described to anybody else. And so I think there is fear, like Dr. Brown mentioned, Italo mentioned, just even having something different, having something concerning, like, well, is this going to be it? Is this going to be the one that does me in, or I'm not going to be able to provide for my family, not going to be able to go to work, not going to be able to put food on the table, et cetera. So I think there's that concern. I think people don't trust the health system. And I think this goes back to what Kevin and Italo were talking about, this trauma being historical. There's years, unfortunately, of experimentation and kind of bad behavior, so to speak, by the health system towards Black individuals, especially to Black men. We classically talk about the Tuskegee Project, which I'm sure Ellen, you probably talked about, and Sheena with other people in this as a part of this series. And that distrust of those 40 years where Black men got syphilis and remained untreated for 4 straight decades is just not going to make people feel comfortable showing up at the doctor, and to be able to talk about their symptoms, much less tell them that something bad is going on. And so I think there's a lot of history that's a part of this trauma. And then the same fears that Italo was talking about feeling weak, not being able to provide for your family, et cetera.
And one of the other things I think is, unfortunately there aren't enough Black providers or Black and brown providers. So Italo mentioned, he'll see someone who's in like an acute emergency situation through the emergency room, and when you're having like a trauma response, right, which could include dissociation, which could include like startled response, so hyper anxiety, you can't sometimes coherently explain what you're feeling, nor can you at the same time explain why you're experiencing it, right? It could be related to, I got held up, I got robbed, and something triggered it. So someone gets you to the emergency room. If you're presenting in that kind of fashion, there's a good chance if you happen to be Black and you're a male, the person's not going to quickly associate, oh, this response is a trauma response. They might assume you're actively, intoxicated or have a substance on board, right? So you get the drug test and it's like all negative, and you're like, oh, wait a minute, let's do the drug test again. It's like, no. There can be other reasons folks come in this way. But again, trauma, unfortunately, for Black males is very low on what we would call like the differential list. But what high up there for Black, psychosis. It's like, whoa, let's slow down. That might not be it. But unfortunately, we don't have enough of us that are on the front lines able to kind of really, in a culturally informed manner, say, wait, let's really think broadly about what's happened here, right? So we just had a couple of weeks ago, Mr. Blake in Kenosha, right? In front of his family, multiple shots, right? One can only imagine what he's going to be experiencing months and years from now. So if there's a period of time where he's under some stress, it's very likely that he could re-experience the trauma that he is experiencing now, but in 2023, right? So it takes someone to really take time, listen, get some collateral information from family members to say, wait, why would this person be presenting to me the way that they are now? It just can't be understated.
I'm so sorry.
Sorry. No, not at all. I have a question for all of you. And I'm so glad you're mentioning this, because in our first conversation, we touched on this also. We touched on, how a Black patient gets completely different diagnosis from a white patient. I think, Sheena, you were talking about this. If you have two hospital rooms and you have a white person in one hospital room and a Black person in the next hospital room, they present with the same exact symptoms. The white person gets diagnosed with one thing and the Black person gets diagnosed with something completely psychosis, mental illness, they're aggressive, even if they're presenting the same exact behavior and symptoms. So how as a Black person going into a hospital, if you have the experience and you have to go to a hospital, what do you do? How do you deal or cope with that fear? The fear of misdiagnosis, the fear of thinking you have a higher pain tolerance, the fear of, apathy and lack of remorse for a mistake. How does one process that?
So Ellen, the same exacerbation that you're having, a lot of patients have. And so I could tell you from personal experience, so in the midst of COVID, which was booming in New York, my parents are in New York. My dad, who's older than 70, had a situation where he needed to go to the hospital. So, okay, well, let's think about which hospital you're going to go to. But I was on the phone with him when he was in the cab, when he got to the ED. I said, no, Poppy, like when the doctor comes in, like, let me talk to the doctor. Not everybody's obviously afforded that opportunity, but I had to make sure because, he's under stress, COVID's rampant, he's older, he's at risk. I was able to kind of be that buffer where they said, oh, wait a minute, let's talk to his son. His son's a physician. But a lot of Black patients really do fear and fear is the appropriate word here, fear going and getting misdiagnosed, because we hear about Serena Williams, we hear about Chadwick Boseman, and these are ultra celebrities, right? And yet still they're getting sometimes not the appropriate care. So one can only imagine if I'm from Compton or Pittsburgh or name any urban city, you're just going to be at more vulnerability of just thinking like, man, I don't know if I could go to this place. So again, it goes back to trap medicine. Where do you feel comfortable?
And
talking to the brothers at the shop.
let me say this real fast.
Ahead,
As you said, you brought up your dad. I bring up my dad all the time. He's a Black man from Saginaw, Michigan. Same place as Draymond Green, same place as Venus and Serena Williams, hard-nosed city. Didn't grow up really interacting with the healthcare environment, but grew up with a lot of interactions that caused trauma, whether it was poverty, like raised in the projects, never having a physician, not having his 2 front teeth until he was a man that enlisted in the Army because he got in a fight when he was young, knocked his teeth out, and never was able to replace them. So imagine years of growing up, not being able to smile in pictures, not being able to like actually emote because it was a sign of weakness and people would make fun of him. My dad has had so many negative interactions with the healthcare system that his son can't even convince him to go see a physician. And it's wild because every single touch point with the healthcare system becomes its own micro trauma, to the point where my dad remembers going to the hospital to visit his mother while she was on her deathbed and would not step foot back into a hospital like admission area because of how that experience was. And so I think about that and how much effort it took for me to get him in the behavior of going to the hospital with my mother. And if it wasn't for the fact that, prior to my mother passing, if it wasn't for the fact that my mom believed in the value of asking questions and having an advocate and having somebody who can help kind of like navigate this system, my dad would never reintroduce himself to this environment. And these are the types of micro traumas that brothers are dealing with across the US, where they had bad experiences. They went to the hospital when their brother got shot. They went to the hospital when, they had a child that, and their partner had a miscarriage. All of these things compound, they never unpack them. And so imagine trying to reintroduce somebody to that environment. It's damn near impossible.
My father, I have a loved one who has he's schizophrenic and he's bipolar. And we had to do a wellness check because he was at the point where we knew that he was unable to care for himself. And my father was like, okay, so I don't necessarily know how to do this. He's like, but because if I call the mental health facility that's nearby, they send the cops and I'm scared that they're going to kill him when they get there. And that is so sad that like we needed help and we didn't know who to call because we thought, okay, well, when the cops get there, they're going to kill him because he's a big guy. He can seem intimidating to them, even though that's your job. You know what I mean? And that's why we have to have people that are mental health workers that are coming out to these situations instead of cops. But there's not many choices. And it's a shame that cops are the ones doing the wellness check. So we waited for months and didn't know what to do, because imagine the fear of knowing that you called the cops for your family member's wellness check and then they become killed. And this is a real fear because, as we know, Daniel Prude, he was one of those people that his brother called the cops for him for a wellness check. The cops arrived. He was naked and clearly in distress, clearly didn't have a weapon because he was naked, and those officers killed him. And this happened months ago and there's still no justice served. So again, even though it may not be our family, we may not know Daniel Prude, he is our family because he looks like us. So that was my uncle, that was my grandfather, that was my father sitting there. And to see that trauma, even though it didn't happen in my family, it makes me think twice when I need to call someone to help out my family. People don't realize that the trauma doesn't run. It's not one channel. It's not like, oh, all the people related to Daniel are afraid. No, every single Black person that sees that video and sees that says, okay, they're going to do the same thing to me, so I'm not going to do that. And that's why people try to minimize your emotions and minimize your trauma. Baby, this shit is scary. It's real scary. It is. I was literally on the plane yesterday crying over Ronald Green's death, and it's just like, people don't realize I'm looking and I'm seeing a father I'm seeing children without a father now. I'm seeing those type of traumas that trickle down throughout the whole family of trauma of seeing Black and brown people killed and beaten by police, by the people that are supposed to protect us, by medical professionals that aren't treating them correctly, or whatever the situation is. And I don't think people understand how much that trauma reflects in your regular everyday life of how you handle medical professionals, law enforcement, the justice system as a whole.
So
As white people, our responsibility is so. So Sheena is here in Los Angeles, came to stay with me, and I sent her a text the night before she flew and said, you know, my assistant is coming to get you. Kate is coming to get you. Stay on text with Kate. Don't get in any other car. Text me the second you land. Text Kate the second you land. Let us know exactly where you are all the time. I'm terrified for her. And as white people, I think it's really important to understand, to listen to these conversations. And it's not just something that's happening to somebody else and you don't look like that and it doesn't impact you. It should impact all of us. It could be your girlfriends, your sisters, whoever. We should have empathy. The empathy tool needs to be amped up 100-fold.
As a human,
Because it doesn't matter that I knew Sheena was gonna get picked up by my assistant. I still was constantly on it, thinking about it, worried. We have to. Active empathy is something I like to say. It isn't enough to just have feelings. Okay, you have feelings. What are you going to do with them? As Caucasian people, we can be actively empathetic. It's not enough to just have empathy. And that is work. That's the job that we have to do and show up for every single day, all day long.
Yeah, I'd be interested to know what my brothers think about this point, because I think, Ellen, that is such a huge point, and that's why I share my stories. I'm sure that's why Kevin and Italo share theirs also, because all throughout medical training, I had to make sure I wore my white coat. I couldn't just roll up in the emergency department or into a patient's room without that coat, without my stethoscope, without my ID on my badge, because I would be the Bengali interpreter, was one of the most common ones or surprising ones that I got. I would be I don't know, Sheena's like, what? I would be the sitter, the janitor, the person, the transport, or for the patient. I would be anything else but the physician. And, I always tweet about these stories, text about them, talk about them, because I think that active empathy makes my friends, my colleagues, my coworkers who never even assumed anything about it, who walk into a room and just shake hands and say, hi, hello there, I'm Dr. X, or hey, hello, I'm Scott. Don't even need to say doctor because it's automatically assumed who they are. And that's just in the professional setting, much less on the outside world where we are, whether it is being triggered because of the police sirens that we see or hear rather, or just the environment that we're living in. So again, I wonder what Italo and Kevin, you all think about how we move beyond just sharing the stories, because I have started to become a little weary about just me being able to share my personal story being enough. And how do we really get the stories of Daniel Prude, of Jacob Blake, of Breonna Taylor, of all the individuals that these stories are happening to, not just us who are in the profession and have the opportunity to have this incredible privilege of speaking to you all today, but the everyday people whose stories I think end up getting missed far much more.
Yeah, so I think in reference to like a tangible solution. So to Ellen's point, individually we should be showing more empathy towards each other. From a either city or federal, national, is there's something that we can consider like political determinants of health, right? Because the reality is that unfortunately within our society, things don't change until they become policy, right? Where someone can say, judge or lawyer, please, my rights have been, violated in some manner. Otherwise, you're just speaking. But if you can point to a docket, that change occurs, right? So Roe v. Wade, voting rights, right? So the reality is that policies have to be put in place, but unfortunately, the persons that put in policies are senators, congressmen, presidents, right? So it is critically important for folks to actually be engaged in civic engagement. To Sheena's point about being able to call the mental health service, and they're going to send out law enforcement. So in some police districts, there's policy that says, oh, when we get a concern call about mental health, in addition to the police officer, we're going to pair that police officer with a mental health counselor, right? So that could be a master's level personnel who goes out and can say, wait. You don't need to have your hand on your gun. This person is obviously in acute distress. This person is obviously potentially intoxicated. Let's appropriately handle that person, get them to an ambulance, and then get them to the hospital where hopefully they can get appropriate care. But that's not uniform, right? So what would be nice if there was some kind of national policy that said, hey, each police jurisdiction, you guys should pair your mental health counselors, licensed clinical social worker, with the law enforcement who are going to go out for these potential calls. But until that's actually on paper, it is just thoughts, right? And we clearly see, thoughts and prayers are not enough. We need policy to be in place. So that's why, I have an interest strongly in policy, because it's not until policies are placed that then change actually happens, right? So a few years, it became law that same-sex couples could get married legally, right? Within the 2000s, but that only occurred because pen and paper went together to actually enforce it. So I strongly advise people to get in the civic game and don't just think, oh, my vote doesn't count. No, it really does matter.
One of the things that
sorry, Italo.
Go for it.
Not just the presidential elections.
Right.
The elections every 2 years, and the president actually doesn't have any power without the House and the Congress and the Senate. Correct. And so, it's the every 2 year elections that are important. Listen, I have a policy idea. Not to crack jokes, and it's a little light moment here, but the truth is who needs the mental health evaluations are the police. There I said it. Who needs to be evaluated? Who needs to talk about their trauma? Who needs to self-assess and needs help unpacking their trauma is police. Listen, I'm not saying that all police are bad. We know not all police are bad. But here is my question, and it's a question everybody asks. If all police aren't bad, which they aren't, where are the good police standing up, screaming from the rooftops that this is not all of us? These people don't represent us. I don't hear enough of that to give the Black community a sense of some little acknowledgement that just some little acknowledgement that we care about what these bad guys are doing. We're not even seeing that. And what I'm seeing here in Los Angeles is actually devastating. In Los Angeles, in Beverly Hills, one of the fanciest neighborhoods you could ever be in. I don't live there, but if I drive there for a doctor's appointment or to go to lunch or something, more than ever, I am seeing, I don't know if it's the pandemic, the riots, more than ever, constantly, I see Black men pulled over, 3 and 4 police cars at a time with a car full of Black men. In Beverly Hills, they're shopping. If people are in Beverly Hills, most likely they're going shopping, right? There's all the fancy stores there. So if you see a car full of Black men in Beverly Hills, most likely they're just going to buy sunglasses at Gucci. It's not that big a deal, guys. And I have a friend, Senate, who has an amazing Instagram account called Mr. Checkpoint. And what he does is he goes around and he films the police. And his sort of tag and motto is always film the police. And if you follow Mr. Checkpoint or Senate's Instagram, you will see, and he's been in Beverly Hills a lot lately. And the other day he was in Beverly Hills and I happened to be at the eye doctor. And I was watching, I was waiting for my eyes to dilate, and I was watching Instagram, and I saw that he was around the corner in Beverly Hills. So I said, I'm gonna get a frozen yogurt after this, and I'm gonna drop you by one. and I met him on the corner, and you know, there he is, he's filming. That was never happening. Oh no, what happened?
We still see you.
I got you good.
Oh, can you still see me? I'm so, oh, there,
Yeah, you're still clear for us.
oh, I feel really tech savvy. I just figured that out all myself.
It was one button, Ellen.
It's the most remarkable thing that I'm experiencing just living here. It's I've never seen this kind of police activity in this kind of pulling